Right to go, guys? Okay, thanks everyone for coming along again this morning. I'm joined by a number of people, Minister Pearson, Commissioner Cassar, our COVID-19 Commander, and Professor Alan Cheng. So I'll speak, then you'll hear from Danny, and then Professor Alan Cheng will go through some detail, then we'll open it up for questions. Just letting people know that the bells are going to ring at 12 midday, so Danny and I need to be in the chamber, so we must leave here at 11:45 at the latest. So I'll take you through the details first. So there are 2 new locally acquired cases of coronavirus, and there is 1 new case in hotel quarantine. Both of the new local cases are known contacts linked to existing outbreaks. One is a child linked to the West Melbourne outbreak. One is a household contact of a worker linked to the Arcare Maidstone outbreak. So both have limited community exposure, and Jerome can speak to that later in terms of answering any questions. A number of exposure sites were put onto the website last night. We encourage all Victorians to continue to check that website and follow that health advice. While we never want to see new cases, it is reassuring that we're again seeing these cases with clear links to existing outbreaks. As you all know, one of the missing pieces we've been looking for in this puzzle is the origin of the smaller outbreak cases featuring the Delta variant, that is known as the West Melbourne cluster. As we advised last week with assistance from the Doherty Institute, we've been checking all known positive cases against the genomic sequencing for the cases in this cluster. I can confirm today that we have now found a match between a returned traveller who entered hotel quarantine in Melbourne on the 8th of May and this cluster. While we have a genomic link, we do not currently have an epidemiological link. Further investigations are underway to see if we're able to establish any contact between the returned traveller and these families. There's currently no definitive understanding of where a transmission event may have occurred, but we are investigating all possibilities from the plane to travel to hotel, and Professor Cheng will take you through the details of the genomic sequencing and the various lines of inquiry in a moment. But I want to be clear about a couple of things. Our contact tracing team has done exactly what we needed them to do. They have found the cases, they've tracked them down, and they have isolated them. Thanks to their outstanding work, we remain on track to later in this week announce, as we've said we've planned to do all along, further easings of restriction in regional Victoria and careful easing of restrictions in Melbourne. This cluster was discovered after the lockdown was in place, and nothing about today changes our plans. So I just want to send that very reassuring message to all Victorians. Nothing about today changes our plans. Thanks to the outstanding work of our contact tracing team, we remain on track to deliver a further easing of restrictions in regional Victoria and easing of restrictions in Melbourne. We all know that hotel quarantine cannot be made risk-free. Hotels are built for tourists, not for managing infectious diseases. There have been at least 21 breaches in hotel quarantine right around this country. Just in the last month, we've seen 3 outbreaks, 1 in South Australia and 2 in WA. Despite all the protections that we put in place, appropriately put in place, vaccination of staff, daily testing of staff, PPE, N95 masks, ventilation works, just to name a few, we cannot eliminate risk in this environment. The fact that Howard Springs is the only system in the country that has seen no breaches really speaks for itself. That's why we pushed so hard to get a purpose-built quarantine facility. Howard Springs is the only facility in this country that has not seen a breach, and that's exactly why we've been pushing for this purpose-built facility. Having that purpose-built facility will ensure that high-risk individuals, whether they come from high-risk countries around the world or whether for their individual circumstances, high-risk individuals put into a purpose-built facility while lower-risk individuals are supported through our hotel quarantine system is the best system that we can have. And that's why, the best case scenario was that this was done a year ago. The next best scenario is that we get it done immediately. And I'm very pleased, as we've heard over the last few days, that that's received the support of the federal government. We will get this facility built, this purpose-built facility built, as quickly as possible. And in the meantime, we will do our absolute best within our hotel quarantine system to reduce risk as much as is humanly possible. I'll now ask Minister Pearson to provide some information about the CQV operational response, and then Professor Cheng will speak to the details of the genomic sequencing and those lines of inquiry, and then we're all happy to take your questions. So, Danny?
Thanks, James. So we were notified last night by the Department of Health of a genomic link between a return traveller in our system and the current West Melbourne cluster. We immediately set about cross-checking all of our data and systems to see if we could establish a breach or link between the traveller and these cases. The traveller arrived from Sri Lanka on the 8th of May and tested positive that same day. He was transferred from the Novotel Ibis Quarantine Hotel to the Holiday Inn Health Hotel on the 9th of May. He completed his 14-day quarantine and was released on the 23rd of May. Our investigations remain ongoing, but I can so far confirm the following. There were 24 people on the traveller's plane, including crew. All passengers tested negative. All Skybus crew from that shift tested negative. 268 CQV staff worked at the Hotel Ibis on the 8th and 9th of May, and 360 staff at the Health Hotel. No positive tests have been identified to date, and staff surveillance testing is being examined. All 12 residents housed on the same floor in the Novotel Ibis Hotel have tested negative. None of the residents in the Holiday Inn Health Hotel during the relevant period had this strain of the virus. And all CQV staff at the Novotel Ibis and Holiday Inn were vaccinated by the 3rd of May. While we are continuing to review CCTV and incident logs again, I can also confirm that so far there is no reported or obvious breach of infection prevention control protocols or anything else that would indicate a transmission has happened inside the hotel. I will now hand over to Professor Cheng.
Thanks, Minister. So, as has been outlined, further work at the Doherty has identified this genomic match between an international arrival and the West Melbourne Delta cluster. And I think the Minister has provided details of the gentleman who arrived on the 8th of May and was in hotel quarantine until the 23rd of May. And his genomic sequence is an identical match to the second of the two families identified at the North Melbourne Primary School. So what this does suggest is that there has been transmission, either directly from person to person or indirectly either via unidentified cases to the family and the community, or less likely, perhaps the source of infection for both cases, for example, from another traveller from where this gentleman came. The investigation is continuing, but there's four main theories, and some of them are more or less likely. The first possibility is that the case transmitted to or was infected by someone, another passenger on the plane, and that person has gone on to infect someone in the community. The second possibility is that the case transmitted after his time in hotel quarantine, after he left. The third is that the case transmitted to a staff member somewhere along their journey from the airport to transport to the first hotel to transport to the second hotel and then out to the community. And then the fourth possibility is that the case transmitted to a hotel resident who is then transmitted to the community after their quarantine stay. So we've addressed all of these, and some of these are still ongoing investigations. So in terms of the first possibility, whether there's someone on the plane that may have become infected and then infected someone else, We've reviewed the details of the 24 people that arrived on the same plane. They were all designated close contacts because this gentleman tested positive soon after arrival. And we've confirmed that they all tested negative before leaving quarantine, and no one was exempted from hotel quarantine. We've checked the details of the flight crew, and they did not leave the plane. To address the second possibility about the case transmitting after his time in hotel quarantine, we've reviewed the swab and serology details of the case, and we've determined that he was correctly cleared. So he was not felt to be infectious when he left isolation at the health hotel. However, we're still following up the contacts of this gentleman after his discharge to make sure that there was no transmission after that. In terms of the possibility of transmission to staff members along the way, Minister Pearson has outlined some of that investigation, but just to reiterate, we've looked at all the potential contacts of this person from his arrival, and this includes CCTV at the airport, surveillance swab results of hotel staff, of cleaning staff, of transport staff, including the transport teams and the Skybus driver. We've looked at incident reports at both the CQV and the health hotels. At this stage, we've not identified any high-risk incidents or interactions with staff or residents that may provide a clue as to the link to this outbreak. In terms of the last possibility of the case transmitting to a hotel resident, we've reviewed the details of all the residents on the same floor as this case at the first hotel. All 12 had negative swabs before leaving hotel quarantine, but we're checking on their swabs after discharge. We're aware that at least 10 of them had a post-discharge swab which was negative. At the health hotel, obviously all the residents on that floor are cases, and it's very unlikely that they would have acquired a second infection while they were actually infected. So in terms of the significance of this finding, it's significant for a few reasons. First, we now have a source from which to start from, so we can start contact tracing or start investigations not only upstream from the North Melbourne families, but also downstream from this case. And this is similar to where New South Wales was with their Wallara case and his wife. Secondly, this also does mean that we have a start time for the outbreak. So we now know that it couldn't have been in Victoria before the 8th of May. And that is significant because it means that there's unlikely to be very widespread transmission for a long period of time before this outbreak was detected in North Melbourne. Thirdly, this does change our understanding of the sequence of events. We had been working on the likely scenario that the family that had been in Jervis Bay had been the first case in this outbreak. This finding does suggest that perhaps it might have been the other way around. We can't be completely sure at this stage, but we're also investigating the possibility that the second family was actually the first to get infected and then have transmitted it to the other family. So I might leave it there and happy to take questions.
Which one of those four theories are you most leaning towards? Do you favour one of them?
Look, I think we have to run all those theories to ground. I think the least likely is that there's someone on the aircraft that's become infected and then been released from quarantine. And the other three, I think, are active lines of investigation.
Is it possible that there's been a false negative somewhere along the line?
Staff, at least for staff, and in fact residents as well, they're tested multiple times. For residents in hotel quarantine, we test them at day 12 and day 14 for that extra security. For staff, they're tested every day, at least weekly by nose thread swab, and then daily by saliva, and then if they're symptomatic, they get a test as well. So again, no test is perfect, but there's very frequent testing.
Are you surprised that it got out? Does that surprise you?
I'm very surprised it got out, but this is what we have, and we'd need to try and work out exactly what's happened here.
And do you think you'll work out how it got from that person in the hotel to these families?
So you'll understand we have this information for about 12 hours, and this is where we've got to at the moment, and we just need to keep investigating this to try and work out. It does seem to be likely that there's a genomic link. We just need to draw that epidemiological.
It just seems difficult in these cases to actually connect connect the dots. Do you think you will?
And New South Wales had the same situation with their Wallara case, and they weren't able to find it, but we need to pursue our lines of investigation as well.
Can I just confirm, is one of the hotels involved the Novotel Ibis, Melbourne Central?
Yes, no, I can't remember exactly which Novotel Ibis, but perhaps the Minister might be able to help. Yeah.
So last week we had confirmed that at that hotel there's dirty linen from positive cases being stored in an underground car park that 450 residents, some of whom are food delivery drivers in a neighbouring apartment building, have access to. There's also medical waste in that space. Have you guys been examining whether or not that situation may have contributed to this leak?
So Commissioner Cassar personally inspected the Ibis Hotel prior to its commissioning, and no issues, no defects were found in relation to the hotel being commissioned.
There are also residents in that apartment building who are concerned about the fact that they're using lifts that are also used by staff members from that building. Are you certain that that has not had any impact on the situation we now find ourselves in?
And can you just take your mask off before you answer that? That's okay.
Sorry,
That's okay. Thank
sorry,
you.
that's better. My apologies for that. So what I can confirm is that all staff in the red zone wear fit-tested N95 masks and they wear face shields. They wear high standard PPE. We had an air filter on the corridor of the floor where this gentleman was. Bear in mind at this stage, Sri Lanka wasn't identified as a country of concern. That became a country of concern a week later. All the staff had been vaccinated and we had really strict IPC controls. So we're going back, we're reviewing everything to try and work out whether there's anything that we may have missed. But at this stage, there's nothing in terms of the examination today that would indicate that there's problems in relation to an IPC breach here, but that's going to form part of the investigation.
So just to be clear, you're satisfied with a situation where we have staff members from hotel quarantine coming into contact with apartment residents in a lift, moving through a car park area to get to their bikes in some cases as food delivery drivers, where they're walking past dirty linen used by positive cases and medical waste. Well, I don't believe that has posed a risk.
On those specifics of the operation, I might ask Commissioner Cassar to supplement my comments. What I would say is that our workforce don't live on an island. They go to work and they come home and they socialise. They go out. What I'm saying to you is that they have been vaccinated. They are wearing.
Apartment residents, a lot of them haven't been vaccinated.
No, but in relation to the virus needs. Overwhelmingly today, it would seem that it needs people to transmit the virus. So I suppose what I'm trying to give you some reassurance is because of the fact that we've vaccinated our staff, because of the fact that we've got really strict IPC controls, and we've got N95 masks, fit tested, we've got face shields. What I'm saying to you is that we've really tried to get this right to reduce the possible risk of a breach that would lead to that escaping the hotel. But I'm not sure whether Commissioner Cassar might want to supplement my comments just in relation to your specifics. Rachel?
Thanks, Rachel. So yes, we have investigated those allegations and can confirm that there is no sharing of entries with the residents. The residents actually enter on the opposite side of the building, and myself and two of our Deputy State Controllers of Health inspected that, and we're satisfied with the controls in place.
That's not what residents have been telling me. They've been saying that you've got the benefit of having been there, I don't, but what residents have been telling me is that there are people who need to get to their bike cage who've been moving past this medical waste and to an exit that they have access to in this shared car park area.
The only other thing, Rachel, that we can add is that we've actually offered to sit down with residents and talk this stuff through and talk through if there are any concerns with the hotel. Again, the clinical waste is on the hotel side, in secure bins, not accessible.
Residents raised these concerns, I understand, in mid-April. Why are you only offering to sit down with them now? And why is sitting down with them even an option? Surely a quarantine hotel, by definition, should be completely separate from an area that residents are moving in and out of.
So the residents, as I said, the residents use a separate entrance. There is a rear exit, a part to come in and out, which is the hotel's entry and exit. We've always put the offer on the table, and we always will. If there are residents that are concerned, that we are always happy to talk to residents. That's not a new thing. And we've done it in the past, and we'll do it in the future.
Can we just ask, I don't know if the Deputy Chief Health Officer can answer how possible or likely it is, excuse me, how likely is it that the virus could get out dirty rubbish, shared passageways? Is that a possibility?
Oh, look, I mean, I think, you know, there's the various modes of transmission, aerosol, contact, and then one of those, droplet, and then one of those is indirect contact through contaminated objects. We don't think that's a particularly high risk, but it is a risk, and it's important to make sure that there are precautions around that. You know, things like double, you know, in hospitals we have a system for clinical waste, there's double bagging, you know, disinfection of the outside of the bags and so on. So I can't speak to the specifics here, but you know, there are precautions around those sorts of things.
In terms of contact tracing now, Professor, what are the main leads? Where do you look now? So are you going to track the movements of people on the plane, on the sky bus, on the positive cases movements on the days he left hotel quarantine, on all of the staff he interacted with? Who are the key people you're looking for? And also the positive case, where does he reside? And has there been any kind of preliminary link drawn between the positive case and either of the North Melbourne families?
So no direct links are known. He doesn't live in the West Melbourne or North Melbourne area.
Where does he live?
He lives in Glen Ira, LGA. We're following up with his household members to make sure that they themselves didn't get any infection. So in terms of just the other leads that we're following, I mean, basically we're following this person from the moment he entered the country to you know, where he is now. And that includes, you know, the airport, there's the transport from the airport to the Ibis Hotel, there's his stay during the Ibis Hotel, there's his transport from the Ibis Hotel to the Health Hotel, and then there's his discharge. It'd be fair to say that it's most likely that it's probably going to be earlier rather than later in that state, because your infectivity drops as time goes on. And as I said before, we did review his swab results and his serology results. He was serology positive just before he left, and that was, you know, that's evidence that you know, he's no longer infective, and that was a determination made, and that's something that's done for all people with variants of concern.
You're working on the fact that there is probably a missing link between the West Melbourne family and this man?
So at this stage, that's the hypothesis we're working on, but obviously if there was any direct interaction, you know, we would want to know that. But we don't know that at this stage.
And just one missing link with those dates, do you think it should just be the one?
We can't really tell. I think, you know, just in terms of timing, yes, that probably is about right, but we didn't. You know, the first person in the North Melbourne cluster became symptomatic probably around the 25th. One of those cases was thought to be historical by that time, so there's still a little bit of uncertainty about, you know, which exactly was the first case, and therefore that determines how many people might be in between.
I don't like your question. On any of the staff that may have interacted with him from the moment he arrived to determine if any of them were in fact positive.
Well,
and do you now go to Glen Ira and do mass testing around that LGA?
So I think the principle is that we generally work in concentric rings. So we'll test, you know, the closest people that he's been interacting with, and that's obviously his household members. And if they are negative, then I think it's less likely that there's transmission beyond that. But as I said, I think most of the focus is actually probably going to be on the beginning of his time, because that's when he's most likely to be infected.
Are you likely to lift on Friday? You said before it doesn't change your thinking. I'm sure there's tons of people watching who want to know. Are we likely to get an easing on Friday?
So at the moment, you know, all the indications, we've had 2 cases today. Most of the cases that we've had in the last couple of days have been people that we've already known about, and therefore, you know, barring, you know, obviously what's happening in the next few days, which we don't know at this stage, we're on track to change those restrictions on Thursday night.
So as long as you don't get unexpected cases, things will lift?
At this stage, yes. Yep.
So you're concerned that there's mystery cases linked to this Delta outbreak out there?
In some ways, this is a little bit reassuring that we now have a start time to this, so that we know that it couldn't have been present in Victoria before the 8th of May, and therefore the chance that there's many chains of transmission that we don't know about is probably less. So this does give us a little bit of reassurance that that's the case, as opposed to in other situations where it might have been many weeks between where there's undetected transmission. I think that there are also other things that would give us that reassurance that there's been enormous turnout for testing. I think it's close to 10% of Victoria has been tested in the last week or a couple of weeks. It'd be hard to think that there's undetected transmission with that level of testing at least.
Sorry, can I just confirm?
Glen Ira. Do people in that area need to be worried? Do they need to get tested? Just because we've mentioned that suburb, and when we do that, people tend to panic. So
I think again, just as anyone in Victoria, if you are unwell, please get tested. We are not particularly concerned about his movements after he was discharged from hotel quarantine because we don't think he was infectious. But for the abundance of caution, we're obviously following up his contacts as well.
So to confirm, we've got the city of Glen Ira and then we've got the suburb Glen Iris.
The LGA, Glen Ira. Yep.
So can I just confirm, did he test negative or positive on his test in quarantine, and what days are they being tested in the quarantine?
So he tested positive, so pretty much on arrival. So he arrived on the 8th, the test was taken on that day, the result came back the next day, and then he was transferred to the health hotel. He had a number of other swabs during that time there, and then towards the end of his time, he also had serology taken.
He was discharged on the 22nd?
23rd.
23rd.
Are travellers still being tested on days 19 and 20?
So 17 and 21. So just to draw a distinction, this gentleman had infection. We don't routinely test people after discharge. We test people after the people that don't have infection, that are in quarantine, after they leave quarantine for that possibility that they might acquire it in quarantine, but obviously he's a case, so he's not going to get infected again, as it were.
Does it strike you as unusual or maybe just lucky that despite having the highly infectious Delta variant, none of the other passengers on the plane or anyone on the Skybus has tested positive?
I think I made this point before that there is this super spreading sort of phenomenon that most people don't transmit to anyone. So 80% of people don't transmit to anyone. It might be a little bit different with the Delta variant, but most people don't come into contact with other people and infect them, but a small number of people infect a lot of people. And that's the pattern that we tend to see. And that relates partly to the precautions that are taken, the number of people they come into contact with. Obviously, there are precautions taken on aeroplanes as well to prevent infection. And by all accounts, I think there were 24 people on the plane. It doesn't sound like a particularly crowded plane.
Have all Year 3 and 4 students and their families been sent into 2 weeks quarantine at North Melbourne School? We've been told by parents that happened overnight.
So I understand that all the contacts at North Melbourne are now being upgraded from a Tier 2 to a Tier 1, and that's because the case that was diagnosed yesterday was in a different grade to the 2 students that were diagnosed first.
Just another one. He arrived on the 8th of May and tested positive in hotel quarantine. Last week, I think it was, we were told that there were no Delta strains detected in hotel quarantine that were genomically linked to the Delta strain. Why didn't we have genomic testing on this particular case until now?
So as of last week, when we went through the database, there wasn't any match to this. So it's like a fingerprinting database, so you can rule all those people out. There were I think 7 strains where we were not, there wasn't genomic data available, and the process is that there's a quality control process that's gone through after that barcode is read, and it had failed twice. Because in hotel quarantine, that would be normally the end of it, that they would, they've tried twice, they're not able to do it, and for hotel quarantine cases, usually it's not of that significance that we require extra work to be done. Because of the interest in this case, and we were looking very hard, we asked all labs in Victoria and so all labs in Australia to upload any data they had, and we went back to those 7 swabs, and the Doherty did extra work to try and get usable information out of that. They were able to get a high quality sequence out of that, and then that link was made yesterday.
Transmission occurring at the R-Care residence home. We saw someone test positive on Saturday, a worker. Is it being transmitted in the workplace?
So in terms of just the R-Care facility is obviously separate to this outbreak. Yep. So what we so someone has worked while infectious and infected 3 residents, and then there has been transmission within the home to other workers as well.
So the workers are catching it from the residents, or?
Sorry? No.
So the workers are catching it from the residents. The worker comes in, gets it to the residents, and then the residents are giving it to other workers?
We're not entirely. It's not really possible to tell that. We don't know.
Have you found a link between their Maidstone outbreak and then other cases yet?
No. So what we do know is that genomically it seems to be linked to the sort of general City of Whittlesea, Port Melbourne outbreak. So it is the Kappa variant, but the first person in that outbreak doesn't live anywhere near Whittlesea, and as far as we know, wasn't up in that direction, and we haven't been able to identify any other epidemiological links at this stage.
Do you know whether it's more closely linked to some cases in the Whittlesea Port Melbourne outbreak than others?
It does seem to cluster a bit more closely to the Port Melbourne outbreak, but it's a little bit difficult to say. We can't really be conclusive on that.
Can we just ask the Premier a few questions? Is that okay? Excuse me. I'm sure people will say this is a failure of hotel quarantine. How do you respond to that?
Well, just reiterate, Raf, the message that we've been sending out the whole period of this pandemic. You know, we do our absolute best in hotel quarantine, strict IPC controls, PPE, testing of staff, the ventilation assessment. We're the only jurisdiction to do that ventilation assessment and then make all those changes within our hotel system. We are making it as risk-free as humanely possible, but it has never ever been a zero-risk environment. That is not the nature of hotels. Hotels are built for tourists. They're not built to tackle infectious disease. So we do the very, very best we can, and appropriately made the decision, way back early first quarter of last year. We didn't have a national purpose-built system to deal with returning travellers. So states and territories and the Commonwealth made the appropriate decision to have hotel quarantine. But what we absolutely need, and we needed it a year ago, are purpose-built facilities for our highest risk individuals.
Can I ask if you want to test people maybe on day 20? Like, do we need to think about testing people 2, 3, 4 days after they finish quarantine?
So Professor Cheng took you through one of the least likely outcomes, and that is that this individual was infectious post-release. But in terms of that question about what happens post-day 14, it was actually a subject of conversation and discussion at National Cabinet last week, and the Prime Minister outlined that this question has been referred to AHPPC. So in terms of this individual, and his release, it was absolutely appropriate. It's highly likely he was not infectious upon release, but we're chasing down that line of inquiry because you've got to chase down every line of inquiry. But in terms of what happens post 14 days, that is something that AHPPC is looking at.
And do you think you need to think about prioritising teachers for vaccinations, maybe even just in that part of the city?
Look, we want to increase eligibility for people to get vaccinated as quickly as possible. We're now in a position where everyone over 40 is eligible to be vaccinated. I'd love to increase that. It is always subject to confidence of supply of the vaccine. We've had some additional supply, which means that we've got confidence that we can continue the very high levels of vaccination that we're tracking through over the last week or two. But in terms of expanding it beyond, That's really a question at a national level, and it's a question of how much confidence we have in supply.
But you can
I'd love
expand
to
it.
expand it, but...
You could for teachers in that part of the city, couldn't you? You could make that decision if you wanted to.
Well, that will be based on public health advice, Raf. We've had, over the last few days, priority access for aged care and disability workers. This week we've got priority for our paramedics. But in terms of any large-scale expansion to age cohorts or particular sector cohorts of people, that is subject to confidence in supply. At the moment, we've got the confidence in supply to make the announcement that we did around 40 to 49-year-olds. Beyond that, we're not in a position to do that just yet.
The last time we had a major hotel leak going into winter, we paused flights for 4 or 5 months last year. So your government's clearly not shy about shutting the door. Would you potentially consider reducing the number of people coming into the state over winter if, say, there is concern about an IPC breach, or if an IPC breach is confirmed? Would you consider action to actually just reduce the risk?
No, there's no changes in our plans in terms of the number of return travellers who will be accessing hotel quarantine. Our focus is getting this purpose-built facility delivered as quickly as possible.
You talk about that being kind of the panacea to the problems. The condition of the Commonwealth is that it's in addition to hotels. So it won't solve the issue of the risk inside hotels. They'll continue to run.
The issue it addresses, and it's the most important issue, is about reducing risk and managing risk in the best way possible. If we had a purpose-built facility for people with the Delta variant, for example, not being catered for in hotel quarantine, but being catered for and supported in purpose-built facilities, that would be a much, much better environment. The prime objective of the government is about reducing risk for Victorians and for all Australians, and that is lower-risk people through hotel quarantine, high-risk individuals through a purpose-built facility.
The Commonwealth is still... Sorry. You go, Shana.
Can you give Victorians any hope about what tomorrow will hold in easing of restrictions, if there's an announcement it's likely to be tomorrow?
Look, I can't foreshadow anything today, other than to reassure all Victorians that today doesn't change our plans. We remain on track to provide further easing of restrictions in regional Victoria and careful easing of restrictions in Melbourne. So we remain absolutely on track to deliver that, and that's by virtue of the excellent work of our contact tracers.
And I asked yesterday, but I asked the Health Minister, can I ask you what that means for remote learning? Is it likely that children will go back to school?
Look, again, I cannot foreshadow anything. As Professor Cheng and Professor Sutton absolutely say, this is a day-by-day assessment, but we remain on track for easing of restrictions. As Education Minister, as a parent, I want all kids back at school as quickly as possible.
You said we have excelled. Would you even consider easing the travel between Metro and regional Victoria over the long weekend?
No, it remains the public health advice that for a period of time we will have different settings between regional Victoria and metropolitan Melbourne, and that will extend beyond any announcements that we'll make later in the week. And there's very good reasons for that. We absolutely want to run this into ground and ensure that there's no risk of this spreading out into regional Victoria. So we wanted to be upfront and honest with people at the earliest opportunity, particularly because we're coming up to the long weekend. So we are on track for an easing of restrictions as planned this week, but there will be different settings for a period of time between regional Victoria and Melbourne.
What payments are available from today? So many part-time workers don't qualify. What would you say to those who are missing out?
Look, whilst we absolutely welcomed the Commonwealth coming forward with income support, as is appropriate, that's a Commonwealth responsibility. There are a number of conditions Those are questions that you really should put to the federal government in terms of income support and the levels of conditions that they've put on people receiving that support. Whilst we welcome it, our response appropriately is on business support, and over the last couple of weeks, that support totals up to almost $500 million.
Will the government be prepared to step in and help them pick up the slack?
Look, I think it's really clear, and this was a discussion at National Cabinet again last Friday. The almost unanimous view of states and territories is that business support, the responsibility of states and territories, income support is the responsibility of the Commonwealth, and the Prime Minister is comfortable with that. In terms of questions about the adequacy of that income support, that really should be put to the Commonwealth.
Mr. Molina, you pointed to the success of Howard Springs. That's staffed by AUSMAT professionals. Under the Victorian and Commonwealth proposal for the quarantine hub here, that would be staffed by Victorian staff. Are you confident that they'd provide the same level of success, the same rate of success as AUSMAT professionals?
Yeah, absolutely. And just to point out that in terms of Howard Springs, my understanding is the Commonwealth has requested Northern Territory to pick up the operational responsibility of that facility. What makes a difference are purpose-built facilities. That's what we need in Victoria. That's what New South Wales is calling for in New South Wales. Really, we should have these facilities right across our country.
And just on reopening as well, when you do announce the next stage of reopening, potentially tomorrow, will you provide a roadmap saying this is the settings we're going to this weekend, this is what we can expect in 2 weeks, just to give businesses and people more broadly some certainty?
Yeah, we want to provide as much comfort and certainty as is possible, and that'll be based, as always, on our public health advice. But I want to reassure all Victorians we are on track, we remain on track to have some easing of restrictions announced this week.
Can you say whether it'll be tomorrow or are we waiting until Thursday?
Look, I don't want to foreshadow what we're going to announce. We're still public health, still working through all the elements. It is a day-by-day, hour-by-hour analysis about how we are tracking. But we had the 2 cases today. They are linked. That's reassuring. We remain on track to provide that easing of restrictions to all Victorians.
What's your reaction to the opposition statement questioning Dan Andrews' fall?
Oh, look, we are dealing with a global pandemic, for goodness sake. I treat it with the contempt that it deserves. This is more about how the Liberal Party treat people. No decency, no respect. They should be ashamed of themselves.
Have you spoken to the Premier about this, and what's his view on all of it?
Look, I'm honestly not going to spend much time on this. I think it's a disgraceful act by the Liberal Party, and it's just not something that I'm going to spend much time on.
Ambulance Victoria put out a statement this morning clearing up those details. Do you think this puts it to bed? And I guess, what's your observations on the fact that it came to this point, that Ambulance Victoria had to put out this statement?
Well, I just think it reflects on the Liberal Party. It reflects on the Leader of the Opposition. They should be ashamed of themselves, quite frankly.
Are you expecting to have confirmation before the end of the week of exactly when the Premier will be returning to work?
As the Premier indicated, he'll be engaging with his doctors this week, and we'll be able to give a bit more advice in terms of what the exact timeline will be. So he's got an appointment with his doctors. His recovery has been on track. This is you fracture your vertebrae. Like anyone who's had a serious back injury knows how painful it is and how long the recovery is. So the Premier indicated he'll have more to say in terms of his return. It'll be sometime this month, based, as always, on his doctor's advice.
Do you share the view?
Disclosure, maybe more regular and thorough disclosure by your government on the Premier's status. Could that have put to bed some of these rumours if there was more ongoing kind of discussion around where he is, maybe a more active social media presence on his front?
No, I don't accept any of that. You can't put to bed conspiracy nutters, and if the Liberal Party want to act disgracefully, that's a matter for them.
Do you share the view of Tim Pallas that the Liberal Party should offer an apology?
Oh, yes, I do.
And where should that occur and when?
Look, we're dealing with a global pandemic. We're outlining, what is a really important issue, and actually, as Professor Cheng, are quite reassuring in that we've been able to track down the individuals and, importantly, the timeline of this Delta variant outbreak. We are working day and night keeping all Victorians safe. For the Liberal Party to act as they have reflects on them, reflects on how they treat people. No decency, no respect, and I really don't want to talk any further on this issue. Yeah, absolutely.
Sorry, you said of those 4 scenarios, some are more or less likely than others. Is there one that's most likely at this stage that you're aware of?
I think we're having to chase them all down. I think the first 2, so that there was someone else infectious or infected on the plane and they've got out, I think is the least likely, because we've checked all those 24 people and made sure that they were all in quarantine, none of them were exempted. The second one, being that it was infectious after he left the health hotel, I think is also pretty unlikely, but that's one that we're obviously checking through. And then the other 2 options are, the possibilities are that he's infected a staff member or another resident, and I think they're the ones that are still active. But again, we've looked through all the surveillance testing. We're trying to make sure that everyone's had their surveillance testing done. At this stage, we haven't identified any opportunity for someone to be infected, let alone them coming positive and on the test. But I think I've talked to before about the hierarchy of protections. We have testing, we have vaccination, we have all the PPE, we have the engineering controls, the airflow reviews, all these things that have been done at CQV over, now, a number of, over a year now. Things can still get through, and clearly in this case something has gotten through somewhere, but and we just need to find it.
When do you expect to find those? When do you expect to find which?
Look, as I mentioned before, this information is about 12 hours old, so this is where we've got to at this stage. Some of the tests will take some days to come back, but the investigation will proceed over the next days, and hopefully we'll find something. But we'll just need to run all the leads that we have to ground.
Alan, just on genomic testing, you said that previously you couldn't establish that link because the data initially wasn't usable, and it's only by going back and essentially putting it through the system again, you've been able to see that link. Yep. Going forwards, do you think maybe more of an effort should be made to I guess, reanalyse those the genomic testing that can't quite be used to prevent, this has caused a minor delay?
Yeah, I think that's something that I have to discuss with the Doherty team. I mean, they do make significant attempts to resequence things to make sure that they can get usable data, but obviously we'll have a look at those again with the information and what they've been able to glean out of this case.
So just to confirm, with the COVID clinic at the convention centre, it is only tier 3. Has a positive case been there? What's the significance of that?
Yeah, so there has been a close contact that had been at that site, and tier 3 is really the same as the rest of Victoria. If you're at all unwell, please get tested. I understand that the level of contact that person had was pretty minimal with anyone else. There was an interaction with one of the nurses at the clinic, and that was really about it.
Are they still tested daily, even after being vaccinated?
Yes, they are. Yep.
And are their families tested as well, Alan?
No, their families are not tested, but we do test. Obviously, the way it would get into their families would be through them, and they are tested daily. That's a saliva test as well as a nose and throat swab at least every week.
Given the aerosol transmission concerns that we've seen in hotel quarantine, as well as links now to the Delta variant, are you concerned about positive cases being able to isolate at home in high-density residential apartment towers? We know that there's at least one case in the Docklands. They have presumably even less oversight than people in hotel quarantine. Are you concerned about leaks there?
we support everyone who's required to quarantine, and if we test them and if they become positive, then we offer them support to make sure they can isolate. Part of that decision about whether they can isolate safely where they are is an assessment of all, how many bathrooms do they have, how big is the place. If they can't quarantine safely at home, then we offer them alternative arrangements to quarantine elsewhere.
Would there be circumstances where you said to someone, look, you're in an apartment building, we have concerns about the risks of aerosol transmission to other apartment dwellers, we don't think it's safe for you to quarantine them?
Yeah, absolutely. And I mean, the most common would be that they only have one bathroom and there's two people in the apartment and they can't safely quarantine. But we take everything into account when we look at, the situation where people are. And if they can't safely quarantine, we offer them alternative accommodation.
There are residents in this building, the Docklands, who are concerned about the potential for the virus to spread to other apartments, given what we've seen happen in hotel quarantine in multiple states. Are you sufficiently satisfied that residents of other apartments aren't at risk?
So in terms of the thousands of people that are that are primary close contacts out in the community, an assessment is made for every one of those people. Obviously, where they are in public housing towers, there's extra supports really put in place to make sure that they can quarantine safely, and if they can't, they're offered alternative arrangements to
We've
quarantine.
seen this virus escape when people have opened their doors to get a food delivery at the same time as someone else has opened their door. Is that a risk that you've looked at, there being potential for in this Docklands building?
So I'm not sure exactly which building that is referring to, but in general, we make an assessment of every person that's required to quarantine to see if they can quarantine safely, and if they can't, we can make alternative arrangements to support them.
Can I ask the testing
Last
room?
question.
Just on the new exposure sites, I think there's about 20 that were uploaded last night. Are they from cases that tested positive yesterday?
That's right, yeah. So we had 2 cases that tested positive yesterday, both of them existing primary close contacts. We identified as a result of that a number of additional exposure sites. And one, just to correct the earlier statement, one positive case did have a brief visit to the vaccination centre at Jeff Shed yesterday afternoon. That is now a Tier 3 exposure site. They were immediately directed to leave and to go back to isolation. And can I just say, for anybody who is a primary close contact or anybody who's a positive case, you must get tested, you must isolate, you cannot go to a vaccination centre. Vaccination centres for people who are healthy, fit and eligible to get their vaccine.
So that person was meant to be self-isolating?
That's right. So they were on their way, they completed their test and then they went off and tried to get a vaccination. They were advised to go back to isolation. We have 2 primary close contacts now at the exhibition site who dealt with the individual. Obviously, it's a Tier 3 PPE environment. It's very well controlled, so we're confident there's no wider risk to the public. But for the abundance of caution, we've listed it as a Tier 3 site.
And just of the people that are self-isolating, is that still about 5,800 or?
Yeah, so we were released around 350 people yesterday as primary close contacts, and again, my thanks to them for doing the 14 days of isolation, because it's all part of getting this outbreak, on the ground, and we're certainly tightening our grip as we head into the last few days. So 350 people released. We have a few additional people who have come into the field as primary close contacts, particularly as we've expanded our zone of operation around the West Melbourne outbreak. So we still have around 5,500 people currently as primary close contacts.
North Melbourne Primary School, is it just grade 3 and 4 that have been told to self-isolate?
Yeah, so we've stepped up following the positive case. So one of the children we identified yesterday was a primary close contact, but we have expanded and lifted up some of the PCCs from Tier 2 to Tier 1.
So is that the whole school now?
Not entirely. So we still have some Tier 1 and some Tier 2 contacts, but we have obviously a larger part of the school now as Tier 1 primary close contacts.
There are people in the school community who were concerned that, all of the children use the same toilets, they all use the same playground. Why not just declare the whole school Tier 1?
So look, we feel we've got a really strong field of control and multiple rings of control around the West Melbourne outbreak, and in fact all the outbreaks that we've been dealing with over the last 14, 15 days or so. So we've got, obviously, we tend to focus on those who are closest, have the closest direct links to the positive cases based on their movements, locations of classrooms, etc. So we think we've got that judgment right. We have stepped up some of those measures in the last 24 hours. We'll continue to review the evidence. If we need to do more, we will.
You wouldn't necessarily know, though, if a kid in a different grade had been in the toilet at the same time as one of the grade 5 kids, would you?
No, we would. I mean, obviously, we talk to the kids, we talk to the parents, we look at the school dynamics and how people move around the school. So, look, the teams who are working in our team in Western Public Health have done a phenomenal job with this particular outbreak, and they're really closely understanding the dynamics of that school. And as more information comes in, we adjust up and we adjust down as appropriate.
Alan, when a staff member is fully vaccinated, if they have been infected, does that at all affect the test's ability to find that infection?
No, but it does reduce their infectivity if they do have a breakthrough infection. So the risk that they get infected is less, and we think that the risk of infectivity, if they do get infected, is also less, but it doesn't affect the ability to pick up infection if it does occur.
Sorry if we've already answered this. Do you have the age of the man from Sri Lanka that was in hotel quarantine?
The gentleman's in his 40s.
Do you know if he works in a high-risk setting?
Not that I'm aware of, no.
On regional Victoria, obviously that a lot of operators there, a lot of cafes and businesses will miss out on money that they would have gotten from tourists coming from Greater Melbourne into the regional areas, and that's likely not to happen. There are some mayors that are saying they want that public holiday moved so that they can regain some of that. Is that a possibility?
Look, it's not. We have talked about it. I just think we're so close to the long weekend that logistically the impact, particularly on, as the Minister for Tourism talked about a couple of days ago, the regional to regional movement of people, we just feel we're too close to make any changes. It'd be too disruptive and logistically too hard.
Just going back to the Novotel Ibis Hotel, we had residents in the neighbouring apartment building raise a series of concerns last week. We've now had a case linked to someone who stayed at that hotel that's escaped into the community. In light of that, are you still confident that that hotel should continue operating as it is?
Yes, I am, and Commissioner Casa can go into more detail, but I've been asked this question previously, Rachel. Very, very strict IPC controls, including with the linen. It is bagged inside the building. All the linen is treated as if it is a positive case. As we just heard from Commissioner Casa, separate entrance. So I think all of the controls are in place. So yes, I am satisfied.
I just have one broader question. I know you've got to go, Deputy Premier. There's a case in Queensland this week where a mother was taken away from her newborn child because she had to go back into quarantine and didn't see it. We had a boy who had a funeral the other week, lots of whose family couldn't attend. Are you concerned that, particularly in Australia where we've been very lucky and we have almost no cases, are you concerned that the manic kind of fixation on keeping cases low is leading to kind of inhumane outcomes on certain policy decisions and a troubling psychology in some respects about keeping cases at zero and not accepting what impact some of these decisions are having on people's lives?
Look, I can't speak directly to the case in Queensland. I was involved in the issue here in Melbourne and the funeral for the boy who tragically lost his life. These are heart-wrenching decisions, and these are difficult decisions in terms of exemptions that might apply for funerals or other activities. That's a decision appropriately of the public health team and the exemption team within public health. But we're not through these difficult decisions until we're at the other side of the pandemic. And the only way for us to get to the other side of the pandemic, to be out of this, is successfully vaccinating our population and having purpose-built facilities to deal with highest risk, because we will have risk to deal with, not just for the next few months, but for a long period to come. So I know that these are really difficult, and there are individual examples that really tear at your heart. particularly when you think about a funeral for that little boy and that situation in Queensland. I understand and respect the question, but we've got to follow public health advice because, just think about where we were a couple of weeks ago before this outbreak. And the life in a COVID-safe way, the relatively normal life that we were all leading. The only way to get there is to make sure that we run this outbreak to ground.
Are you concerned that public health advisors may not have all the right incentives to be making the correct calls on a greater societal level? Their incentive is to keep cases at zero. They're not thinking about the impact on the child's family or the individual and their kind of mental health. Are you concerned that not enough consideration is being given on exemptions?
Look, no, I'm not. I'm not concerned about that. And we've heard from Professor Sutton a few days ago. We understand, for example, when we have a period of lockdown and we need our kids to be remote learning at home rather than at school, other than vulnerable kids or kids of authorised workers. We know that has a mental health and wellbeing impact. We know it has for some kids an academic impact as well, and that's why we've got to wrap around support for children and their families, whether it's their mental health and wellbeing, whether it's the tutors. So all of those assessments, all of those broader impacts, the economic impact, the social impact, all of that is taken into account. But you don't defeat a pandemic if you don't take a health first approach and a safety first approach.
Potential Olympic swimmers from Victoria, can you help get them to Adelaide?
Look, I briefly read that report or heard about that report on the way into work this morning, so I don't want to talk off the cuff. You would hope that there would be some support for elite athletes that, for no fault of their own, are subject to all of the restrictions that we're all subject to. So I'm hopeful that there could be an outcome for those athletes, but I seriously have just heard the report. I don't have the details. Okay, thanks everyone.
Thank you.